We're now live, Chair.
Okay, thank you everybody. So we are now live on YouTube. Welcome everybody to the May Rotherham Integrated Care Partnership Place Board. It's our monthly meeting. We're planning to run the session from 9 till 10. Welcome everybody. Glad to see you all. So assume everyone's got a copy of our papers and our agenda. So the first is public and patient questions. So Gordon and Lydia, have we had any patient or public questions which we need to consider at the meeting today?
Not that I'm aware of, Chris.
No, me neither.
Okay, so nothing received, but if people do have anything, please do send them in to you and we'll cover this off as part of our section of our future agendas if anyone has anything. So what we'll do is the first section we have is our business items section, and we go through on rotation our transformational group updates. This month, the first one we'll take is the children and young people first 1001 days. This is down for Susie. Is Susie with us?
Susie's not with us, Chris. I'm standing in for Susie.
Okay,
but I think
thanks, Helen.
We should also have Alex Hawley, who is going to present the presentation for us.
I am here.
Okay, welcome, Alex. Thanks, Helen.
Right.
So over to you then.
Do you want me to share the actual document on screen?
If you could.
Assuming I know how to do that. Hold on a second.
If you can't, Gordon has previously helped me out with that, Alex. Not that I want to put you on the spot, Gordon.
I've got it available, Alex, if you want me to do it.
Yeah, that would be helpful, actually, if you can do that, Gordon. Thanks.
He says. Bear with 2 seconds. There we go.
Okay, that's coming up on screen now, Alex.
That's great, thank you. So should we just move to the next slide, or next page, I think. Thanks. So that's just showing the reg-rated actions under the 1001 days priority area. The simplest way to summarise that picture really is that all the 4 actions have been completed, but a couple of actions have resulted in a plan that now needs to be delivered, and the following slides will provide a bit more narrative against each of the actions. So if we move on to the next one. Okay, so key things I've highlighted against leadership and governance there. The reconfiguration of the public health team is really important. That happened sort of summer last year to align the 4 consultant portfolios to the Health and Wellbeing Board aims, and that resulted in my taking on the Best Start portfolio, which obviously aligns well with 1001 days. The other thing that I've highlighted there is that Best Start and Beyond framework is being developed, and that's really to ensure a better system-wide way of working. And with respect to the commissioning of the 0 to 19 service, the tender for that new contract is now open. Obviously, it's too early to be able to predict the outcome of the process, but I think it's fair to say we have given ourselves the best possible chance of success through an extremely thorough, inclusive process that's guided the development of the specification and the evaluation method that we're going to use. And with respect to the specification, a key aim all along has been to allow some room for some flexibility, both to encourage innovative responses and also to allow for change over time as needs change and system priorities change. And you'll see I've mentioned on the slide there that the Rotherham Parent Carers Forum was involved in a co-production exercise that informed that specification. And that method of co-production is in the specification as an ongoing requirement of the provider, which should mean that it will continue to be an inclusive and responsive model. And the Best Start and Beyond framework that we're developing will provide a way to guide the whole system and how that service fits into the system and addresses gaps that we become aware of. And it's worth, although this was about 1001 days, worth putting it, obviously it's a 0 to 19 service, and the framework will also go across the whole of 0 to 19, in fact, from preconception through to post-19, but it will retain a primary focus on the first 1,001 days. So can we move to the next slide, please, Gordon? So in respect of identifying gaps to inform that framework, a mapping workshop exercise took place with health partners in the summer last year. That was really part of the specification development work for the 0 to 19 specification. Also last year, Early Help colleagues undertook a very extensive survey of partners about the whole of Rotherham's Early Help offer. And that's obviously informing our work now on, and we're using a national management trainee based in children and young people to look at that mapping and to collate actions from plans across the system. And the idea there is to identify gaps in those actions, which are the things that the steering group for the Best Start and Beyond framework will then focus on. And an inaugural meeting of that group is now set up for June, so that will make a start in June. It will be constituted as effectively as a subgroup of the Early Help steering group, and the idea there is to ensure complementarity with the emerging Early Help strategy. So we've now got a draft framework, Best Start and Beyond framework, which will be used for that first meeting. This will also be going to the Health and Wellbeing Board in June as well. And the framework is divided by life course stages, 4 key life course stages. So it provides a vehicle for the 1,001 days action plan to be developed through that process. And down the bottom there is an example of a key action that is already contained within the Healthy Weight Declaration, but forms a key aspect of this framework. And certainly in terms of 1,001 days is the breastfeeding friendly borough declaration. That's also going to Health and Wellbeing Board in June. And that's really, is a sort of a program really of future actions, as a sort of starting point to change Rotherham into a place that will foster a supportive environment for informed and healthy infant feeding choices. I can't really emphasize enough how important that is, because I think enabling every mother to breastfeed for as long as she wishes to is probably the most impactful change we can make to give our children the best start to life and provide them with lifelong benefits. Could I move to the next slide? Thanks. So the things that we're worried about now, obviously commissioning a service for the next 10 years, obviously has some risks attached to it, because the world changes a lot in 10 years. But I think the commissioning process has been very thorough to establish current needs and to establish a specification that is able to adapt to change. And we'll create an ongoing partnership with the provider, whoever that turns out to be. Obviously, as I've said earlier on, the process is currently open, so we don't yet know how it will turn out. But it's there are early indications that there is definitely some interest in the market, which is very encouraging. And obviously, it's not just local circumstances that change or local needs that change. We're always working against shifting policy landscape, and we've already taken account of changes that have already taken place for the guidance to the Healthy Child programme, but we know that further change is expected. And as I said earlier, we've tried to account for this in the way we've specified for that 0 to 19 service. So last slide, please. So this is where we are now. So as I said, inaugural meeting of the steering group for Best Start and Beyond framework meets in June, and that will establish its terms of reference and membership, etc., and set up a strong relationship with the Early Help steering group, which will be a subgroup. And its first task will be to use the work done by our national management trainee, Florence, to identify gaps from actions in existing action plans. And obviously this will then inform the priorities that fall out. And that's it.
Okay, thanks, Alex. Gordon, just take down the screen sharing. Thank you. So thanks for that update. Just open up to the group for feedback or questions, please. Okay, so I haven't got any hands up, I don't think, unless I'm missing any. Okay, so I think what would Ben?
Sorry, I think I clapped instead of raising hands.
That's fine by me.
It was just whether there's anything that needs to go into the 1001 days work that's come out of the Ockenden review and the maternity services work, and how they're connecting up. I think a lot of that focus, I mean, there was the maternity group raised in there, but a lot of the focus is on the 0 to 19s. It's just making sure we're linking across the maternity into health visiting part of the pathway.
Do you want me to pick up that one, Alex?
Oh, yes, please, Helen. Yeah.
I think, Ben, the update has focused on the 0 to 19 work because that was what was in the last year's, those priorities were what were in last year's place priority plan. But there is certainly a lot of work being undertaken with midwifery that colleagues in public health are definitely involved in, and all of those representatives will be invited to that first inaugural meeting in June to develop the action plan. From a Rotherham perspective, we're in a strong position in terms of our midwifery services and the response to Ockenden. We're doing a little bit of activity just to make sure that our voice collection and representation, the way that escalates up, is as effective as it possibly can be. But the services that our mums to be are receiving in Rotherham are very good. We're just working very closely with regional colleagues to make sure that that's the case regardless to where they access their maternity services. And it'll definitely feed in, if there are any gaps in the current action plans, they'll definitely feed into the response that we create as a result of the Best Start and Beyond framework.
Thanks, Helen.
Okay, thanks everybody. So no more hands up. So thanks for the update. So I think the business today is to note that update, and obviously we'll ask you to come back in a few months' time to give a further update on progress and action. So thank you for Alex and Helen for those updates. Our next agenda item.
Okay, if I can I dip out now? Is that fine?
Yes, Alex. Yes, thank you.
Okay, thanks very much.
So our next agenda items, the mental health, learning disability and neurodevelopmental update. Ian, this is for you.
Can you please just confirm that sharing, okay? Yeah, should be sharing. Some apologies because I've shared it. Can't see anybody. It's one of those things. So can somebody share?
I'm just getting some background noise if people want to go on. So can everyone hear?
Everybody here, okay?
I think it's Ian's microphone. Chris.
Is it Ian? Ian, we're struggling to hear you.
Is that any better, Chris? Can you hear me? Okay?
Yes, that's a bit better. You're a bit quiet. So if you could just speak up, that'd be great.
Do you want me to share? I think it might be a microphone. Do you want me to share my screen, Ian, so that you can?
Yeah, would you mind going? Apologies, I've got a connection unstable narrative coming up in front of me, Chris. So I'm hoping you can hear me.
Okay. So Ian, do you want to take? Okay. Do you want to try again now, Ian?
Yeah, I will do. Can you please hear me okay?
Yeah.
We can. We're getting a bit of feedback off your microphone though, so it's a bit in and out.
Chris, can you come back to me and I'll just try and plug my earphones in if somebody wants to go.
What we'll do, well, I'll tell you what we'll do. We'll take the next update, Ian, if you want to log out and in and then and do that. So we'll go on to the update on urgent and community care then, please. So this is down for Michael and Ian.
Yeah, thanks, Chris. We have Steph with us today. If that's okay, we'll just talk.
Yeah, absolutely fine. Hi, Steph. Do you want to come in?
Yeah, thank you very much. So thank you for sharing, Gordon. Could we go to the next slide, please? So I thought, if it's all right with you, I'd do something a bit different this session because we held an admission avoidance and discharge day on the 29th of March, which was a cross-system event with representatives from health, social care, the voluntary sector, private providers, both care homes and home care, and people from NHS England as well asked to come. And the purpose of the day was to celebrate success around admission avoidance and discharge, thank staff for the tremendous efforts they've made through COVID, because this was a really stressful area of keeping flow going across the system, and to plan for next year. So we held it in person at New York Stadium. It was funded by the CCG, so thank you for that. And we also held it virtually, so it was the first time we'd done a hybrid event, and we got really positive feedback from people who attended. It was just really nice to be able to get together in person and share experiences. So in the morning session, we had 10 examples of good practice in admission avoidance and discharge, and we could have had so many others, and I'm just going to pick out a few to share with you today. Then the afternoon session, we had someone called Kevin House from a company called The Art of Brilliance. And he shared with us some ideas around well-being and resilience in particular, gave us a lot of theory and a lot of encouragement, and staff did some planning around their own resilience and working in teams. And then we took that into a wider planning session in the afternoon about the next phase of discharge, which will form the place priorities for next year. So just to share a few of the things that were presented on the day. So in our top left-hand corner up in here, this is Dr. Kirsch. Dr. Kirsch presented online because he actually had COVID at the time, and he was really quite poorly, but he was determined to share the work that he'd done with Yorkshire Ambulance Service paramedics and Leyden Court Care Home. And this was to develop a pathway to support people who'd had a fall in a care home. And rather than being conveyed to hospital, it was about wrapping the right support around them at the care home to monitor them. And they had tremendous success with that, with over a reduction of over 80% across the year of conveyances to hospital. He did share with us that actually there'd been a slight falling off of that more recently when there've been some changes in the care home. And that really illustrated that one of the things we struggle with, particularly with care homes, but across the system, that lots of effort can be put in by everybody to improve things. But particularly with churning staff at the moment, you can soon lose some of those benefits. So it's often a few paces forwards and sometimes some back. So, we do see some bumpy results, but the overall trajectory is good. And this is something that we will be rolling out next year to other care homes. Moving down, we've got Lee Moran here, who's one of the acute matrons. And he was explaining about the work we're doing with patients and colleagues to improve communication. And this includes some of the work, there's been development of producing materials that people have by every bed, which gives lots of information about what you can expect in hospital, what the discharge process is, some of the information around self-funding for social care, and lots and lots of contact points, and there's lots of virtual information as well. So that's something that's being progressed again next year. Moving down, this is Karen. Karen's an Age UK volunteer, and she was explaining the work that Age UK do in terms of hospital aftercare service, which is about taking patients home from hospital and helping them settle in, doing things like a bit of shopping, getting some local adjustments made to their home if they're needed, referring them to other services. So, they may have had a bereavement, they may be lonely, just linking them into the community. And she gave an example of referring people for benefits advice, which has resulted in over £560,000 worth of benefits for Rotherham citizens that would otherwise have gone unclaimed. So really making a difference to individual lives. She also was explaining about the safety netting work they've been doing with us, which was introduced during COVID, and it was to support patients who are being discharged home with no additional support, and just to check that they're okay once they get home. So Age UK phoned them up. If they haven't had a reply within a few tries, they'll actually go and visit the house and make sure they're okay. And again, link them into follow-up services where required. So they've had over 6,300 referrals during the pandemic, resulting in 250 follow-up calls to people's homes. So again, it's a really good example of how we work with the voluntary sector to support people across the system and make sure that they're safe and well. Here we've got a presentation around Discharge Lounge, which is something new that's been developed in the acute hospital during COVID. And we had a video, the link on YouTube if people are interested to what the lounge does. And it's a really great new facility where there's beds and chairs, and people, whilst they're waiting to be discharged, can go and sit in comfort there, bring up their bed so somebody else who needs it can benefit from it. But the person's in a place that can be easily accessible by family or patient transport to be picked up. And whilst they're there, they get food, drink, ongoing care, so they receive their medications, wound care, any support they need, but they also again get advice and support. And it can be a quite scary time for some people, making that transition from acute to home. So it's a really supportive environment for them. And then finally, just picking out Jill at the bottom here. Jill received the award, which was voted for on the day of what was voted as the best example of support and admission avoidance and discharge on the day. And she received it on behalf of a colleague, Di Muldoon, who presented about integrated working to support an end-of-life patient, our most important category of patients. Mrs. J was at the end of life. She'd asked to go home to where she lived with her daughter so she could die at home. And Di was referred the case at 2:30 one Thursday afternoon. By 5:30 that afternoon, she'd put in touch 7 different care agencies involving 11 different staff going in each day to provide the support to Mrs. J that she needed to have a comfortable and happy death at home. And Mrs. J actually passed away 5 days later. And we've got a quote from her daughter here saying, "You made a real difference." And it wasn't just at the time of her mum's death, but it was also in their grieving process afterwards. So it was just a example from on the ground what people do every day in their working lives, but just makes a real difference to people. And obviously during COVID, that was particularly challenging. And as we often talk about in these meetings, with the issues we have in recruitment and retention, particularly where we're supporting people at home, it's really challenging to get those services to join up. But obviously our colleagues just don't lose sight of the individual in all of that. So could we move on to the next slide, please, Gordon? Thank you. And this is Tracy and James. They were explaining to us how the work they've done across the system to underpin all the great work that colleagues are doing out in the community and within the acutes and all our services to keep flow going across the system. And Tracy and James have worked with colleagues to develop a new command centre, and so if you can just see on the screen here, this is an escalation wheel which shows all the different services involved in a flow. Apologies, that's my phone going off. all the different services involved in flow. And it's an escalation wheel which demonstrates what's working smoothly and where we've got challenges within the system. So a couple of slides just to evidence where we're at the moment in terms of performance. These were actually shared by Catherine Hooby, who is the regional lead at NHS England for discharge, and she very kindly did a presentation for us about how Rotherham's performing in relation to the region, and she picked out these couple of slides which showed evidence of success and that we were benchmarking well. So the national target is for 95% of people to be discharged home, and you can see Rotherham has been round about the 94-95% target for a good period of time now. We did have a dip more recently in February, and that related to Omicron and the aftermath of that, when you remember that there was a massive spike in cases in the community, which is causing a lot of staff sickness. So at that stage, we were having to commission more beds to keep flow going. And then this graph here shows NHS England set some targets to reduce length of stay to 14 days, and it shows we achieved our target in March, which apparently we were one of the few areas to do. So that was just a bit of a neutral observation that I thought would be interesting to share with you. So next slide, please, Gordon. So the things we're worried about, Scheme 2 funding has ended. You'll recall that this was the national monies that were supplied to systems to support additional funding and the needs of COVID to keep system flow going. But of course, we've still got ongoing pressures. We've got rising demand, not so much from COVID now, but from unmet demand during the pandemic. And we've still got recruitment and retention issues, particularly in social care. So we've got this tension around flow that if we can't support people who could go home at home, we're still needing to commission beds, and that's creating cost pressures within the system because Rotherham now has to pay for this. And the model needs to be sustainable going forward. Next slide, please, go on. Thank you. So in terms of what needs to happen next, there's been new national guidance published by the government, which replaces the Coronavirus Act and Scheme 2. It aligns very closely with the outcomes from our event on the 29th of March. So it shows we're on track with the national thinking. It continues the home first discharge to assess model and very much focuses on continued development of integrated MDT working. There is a greater emphasis now on patient choice and carer engagements. The principle of right to reside still remains with once somebody's been medically optimised, they lose the right to reside in hospital. And the guidance highlights that if people can't go to their preferred choice, then it may be necessary to have some interim arrangements. So we're busy planning phase 2, which we'll bring to a future meeting, and that will inform the place priorities next year. And the key elements of that will be picking up, as you can see in the word cloud, some of the things that staff picked up that they want us to focus on. So there'll be more engagement work picking up after COVID. We'll be looking at how we can integrate the whole. We've got really strong constituent parts within the system. We need to get better at joining up the circuit that underpins flow. There'll be a ward by ward improvement plan within the acute, a focus on reducing acute community lengths of stay and community bed occupancy rates. and developing a community shared care record and reporting. And of course, we'll continue to focus on recruitment in where we've got gaps.
Okay,
So,
thanks, Steph. Do you want to just pause there and just take this share screen down? So thanks for that, lot in that. So just open it up for comments and questions, please. Okay, can I just come to you, Michael, in terms of how you're seeing it as the hospital and a community trust, Michael? Are you happy with the progress and do you think we've got the right plans?
Yeah, I absolutely do. I think progress is as good as it can be, especially when we're coming out of a pandemic as well. But I think we've got the right plans and the right teams around us. Traction. So yeah, definitely, Chris.
Thanks, Michael. And I've just sorry to pick on people, but in terms of Sharon, in terms of social care, are you happy that we've got the right plans in place?
I'm not getting any feedback otherwise, Chris, but obviously Ian's new in role, so I think it'll be helpful for Ian to be able to review it and just make sure that we are comfortable. But I take it as a really good sign that I'm not getting anything to the contrary. So I'm not worried about it, but I do think it's one that Ian, as the new strategic director, will want to kind of have his own overview and have his purview on it, but not something that I'm worried about. So I think I take that as good feedback.
Thank you. Can I ask Dr. Muta and Dr. Cullen from a primary care perspective, what will be your feedback on the plans?
Thanks, Chris. I don't know, Richard there, can't see him. No, I think as far as I see it from the GP's point of view, everything seems perfect at the moment. Thank you.
Okay, thanks everybody. I've not got any other hands up, so thanks for that, Steph, very helpful. I'm going to move on back to Ian. So Ian's rejoined, so just had some IT issues and come back in. So Ian, you're right to pick up the mental health, learning disability and neurodevelopmental update.
Yeah, morning colleagues. Can you hear me okay this time?
Yes.
Better. Lovely. Okay, thank you. Hope everybody's well. So just 3 short updates if we can today, Chair. Just a quick overview on LD transforming care. A little bit of an update on our all age neuro pathways and the work that's been going off. I know there's lots of work and we could probably talk for an hour on that one. And then just a briefing really on section 117, which is around aftercare in the community. I'm joined by Gary Parvin. Morning, Gary, and Matt Pollard from Ardash as well. I know Gary oversees much of this LD commissioning, and Matt obviously key in terms of provision. So I'll just move us through the slides if I can. So on transforming care, just a couple of things that we wanted to really flag this morning. So just to remind colleagues on transforming care that this is an agenda that's been around a number of years now in terms of learning disability and trying to ensure that people that are not being inappropriately detained in mental health hospitals and wherever possible, returning them into a community setting with supported living. So we'll just describe the work we're doing there. And also the kind of view as a result of that around avoiding premature deaths. So currently our position in the borough, we've got 3 CCG commissioned people in CCG beds that we're trying to return into place. And we've got 2 NHS England commissioned beds that we're trying to work to get into respective places and out into a community setting. So, and again, just to remind colleagues of the commissioning responsibility here in that NHS England commissions from a specialised perspective, and then the CCG commissions from a more general perspective in that space, hence the kind of separation of the 2. So what's working well? As a CCG, we've got plans to resettle 2 of those CCG commissioned individuals. 1 person has been detained in a long-term commissioning bed, so we're looking forward to getting that discharge in August and September. And this is a huge amount of joint work in place to kind of develop both estate to support this individual as well as wrapping community teams around that individual. So having had support from NHSE and capital funded, we're looking forward to placing that individual back in South Yorkshire. In terms of the NHSE commission beds, our target was to reduce to 4. We're currently at 2.
There's a lot of work that's happening again across NHS England and the CCG to support discharge and our local authority partners to ensure we've got good discharge and good pathways in there. In terms of primary care, there's a requirement as part of all our planning requirements and all our must-dos around health checks for people with learning disability. So we have got our local enhanced service for primary care, and we're doing well in that space, but we will continue the focus with individual practices to ensure learning disability reviews are undertaken in a timely manner. In terms of what are the areas we're worried about in this space, increasing potential for admissions of autistic people. We have got increasing numbers of people diagnosed with autism and complexity presenting in our place. So there is the risk, as we always carry that risk of individuals having to be admitted. The challenge with that is that the market, like many markets, are under significant pressure at the moment in terms of COVID-19 staffing and issues of recruitment. So this is causing us challenges in terms of managing the market, again, a timeliness of response to placements where we need to make them, and also put in place those community packages. In terms of next steps for us on LD transforming care, trying to create a greater awareness of autism across universal services and support in this area, promoting opportunities for working in learning disability service, and this is all around trying to get the workforce kind of fit for purpose as we move forward. So it'll be a big focus for us. So if I can just pause there, Chris, I'm happy to take any comments on that first slide before I move on to the wider all-age neurodevelopmental pathway. Is there anything coming through from colleagues?
Okay, thanks for that update, Ian. So just any questions on that before we move on to the neurodevelopmental pathway? People shout up because I can't see hands going up. So I'll assume everyone's okay and move on then, Ian. Thanks.
Okay, thank you. So I know Place Board have received specific updates on the update to the children's pathway and the work we're doing around diagnosis, as well as the adult pathway we've done on diagnosis. Again, the children's one linked to the outcome of our SEND inspection. But there's a lot of work that keeps churning away on this area, and it will remain one of our highest priorities going forward. So what's working well? I've just mentioned the kind of the things that we've got in place now to kind of really drive through on activity to support adults and children's in terms of embedding our pathways. Just to remind colleagues, we took a joint place decision to invest in a Rotherham-based neurodevelopmental pathway all age a couple of years ago now. That activity is flowing through, which is causing us a pressure, which we'll come on to in a second. But again, that's been really well received. In terms of that commitment to funding this space, we also commissioned a post-diagnostic offer from our voluntary sector providers, and this is now well embedded in the Rotherham place and has been kind of getting regional, and I'm sure it will do soon get some national recognition in terms of the work, and I'm sure Gary can explore further if we need to in a second. In terms of what we are worried about, we are seeing increasing weights for the adult element of our Rotherham all-age neurodevelopmental pathway. I think we've got some real key investments in the children's area to try to manage demand, but we are seeing increasing weights in the adult pathway, which we're trying to manage with RDASH and working jointly across the place. It'll be interesting to see from our expectation around national funding streams, because there is a expectation around extending autism service to kind of undertake autism enhanced health checks, which we'd all support, but actually the funding associated with that, we need to see how that will flow in the system over the coming 12 months. In terms of next steps, working really closely with colleagues in RDASH, Matt can speak for his own service in terms of how we want to keep reflecting and reviewing that neurodevelopmental pathway. We have used a digital diagnostic offer in the children's area, that's Helios, so we're looking at options to do that with adults as well, so that's good. Apologies on this bullet point, it's not quite concluded around it. What it should say is promote the council's employment is for everyone programme, which is a really good opportunity to extend opportunities for autistic people. We've actually got an engagement event out at Gulliver's on the 16th of June with local businesses to really try to promote that kind of mantra of employment is for everyone, taking into account people with learning disabilities and autism. So looking forward to that session. And again, we are going to start the discussion with stakeholders to create a big conversation about refreshing Rotherham's autism strategy. It feels like 2 minutes ago since we last updated it, but it is a couple of years. So we really want to stay on the front foot and maintain this as one of our highest priorities in the borough. Okay, Chair, I'll just pause again if I can. I don't know if Gary or others want to come in or any other questions.
Okay.
Space. Thank you.
So is that the end of the presentation, Ian?
There's just one more slide on 117.
Just finish off and then we'll wrap it all up together.
That's fine. So in terms of section 117, this is more a briefing as much as anything. So 117 is around aftercare in our community settings for people who've been detained under the Mental Health Act. Colleagues will be aware that we signed off jointly across the place our 117 policy, so that's a big step forward as a joined up policy, and we're working to implement that at the moment. There is a live discussion around who holds the oversight of that statutory section 117 list. It's currently with RDASH, but we, as a place, we need to have that dialogue, and we'll be bringing papers back through our mental health and LD board in June 2022. So it was just to inform the board this morning that agreement to policy is now in action, but it has pushed out another action around management of patients on that list and appropriate review. So just to note that if we can today, thank you. And I'll stop the share there, thanks.
Yeah, thanks, Ian. It's just easier for me if we can see everyone's faces. Okay, so a lot in that again, so thanks, Ian. Can I just open it up for comments or questions on any of the items raised? So Sharon first.
Thanks, Chris, and thanks, Ian. Another hand. It was just a question, Ian, around the weights and the worry about the increasing weights, and what does that actually look like, and where do we sit against other partnerships in terms of thinking about those wait times, understanding that there's actions to try and reduce them, but are we an outlier? What does that look like in comparison to other systems?
Yeah, thanks, Sharon. I'll just give you a view on the weights, but Matt might want to come in, or Gary, in terms of comparison, because I know Matt provides provision from an RDASH lens across other parts of the system and footprint. So I think where if I'm talking on adults in this space, Sharon, because I know I can come back to the children's, but the adult area specifically, if you recall, we took a strategic view as a place board to invest in a Rotherham-based neurodevelopment pathway 2 years ago now. So that was a new service that we were bringing into Rotherham. Our previous pathway was for Sheffield Health and Social Care Trust to provide diagnosis, and they did a good job at that. But what we wanted to do was create that all-age pathway. We funded, I think it was about £300,000 of recurrent provision to fund that service, and our best modelling suggested that would hold us. I think a view, thinking back, it was about, we were trying to strive for 18 weeks. What we've seen in terms of demand, Matt will probably have the most up-to-date figure, we're now seeing increasing demand in the adult space, and we're probably pushing towards a year. I think that was the last figure I had, Matt. So we need to be really careful in that space of, like, have we got the right level of provision for diagnosis in the adults? Whether that's outside of what other areas are doing, I can't comment because I don't have that information, but Matt might have it.
Okay, can I just come to you, Matt, then, just to enhance that response?
Yeah, absolutely, Chris. I'm just trying to pull the latest figures up, but yeah, Ian's right. We've continued to build, particularly for the ASD, the Autistic Spectrum Disorder Diagnostic Service, because of the much greater number of referrals into the service than we'd ever anticipated, jointly anticipated. We've continued to build a waiting list, and consequently the waiting time has grown for those individuals on the waiting list, and is now certainly in excess of 6 months. We can certainly get the figures pulled together because we're monitoring those regularly. And as Ian pointed out, we've used a similar process using a non-stat provider as has been used in the children's services to try and address some of those, but that's a relatively short-term fix, and the long-term position is that the referrals into the service are certainly outstripping the capacity that there is in there.
Okay, thank you. Gary, is your hand for a response or a question? You're on mute, Gary.
Thanks, Chair. No, it was just to kind of add a bit more detail. So,
okay, come in.
Yep, thanks, Chair. It's just to say, yes, there has been extension waits, as Matt's quite rightly referred to. It is that demand in the system that's coming through. We have found, similar to the children's, adults approaching GPs and wishing to explore whether they have an autism diagnosis, and what we found is a high number of those have actually converted to a diagnosis. To pick up Ian's point about how do we compare, and Sharon, your point as well about how do we compare to other areas. Other areas are experiencing a similar level of demand in terms of weights. I know it's not as it were a comparable authority, but I know there are similar weights being seen across the country. Leeds has a weight of up to 2 years in the system. So, and obviously I'm not in any way trying to say, you know, that makes Rotherham, it's an area that we're pressing on, which I'm pleased to see Ardash are responding to, in the sense of developing that digital offer, which we've seen very successfully developed and applied in children's. And the feedback I've had recently from the service, Matt, is that offer's been taken up, and that's had an positive impact in reducing some of that weight as well. So I think it's kind of be creative in that space. So just to give that update. Thanks, Chris.
Thanks, Gary. So can I just come to Dr. Mutu next?
Thanks, Chris. Just a question and a comment, Chris. The question is basically, yes, the demand has increased, but have we improved the diagnosis compared to all this extra which we are putting towards autism? That's one. And then,
Dr. Mutu, I've just got some sound quality issues. We're just struggling to hear you a bit.
Sorry about that. Any better there, Chris? No? Hello?
Just try again and see if we've got it.
Can you hear me now?
Yeah, okay.
Okay, sorry. Just the question is, since all this input we've had for autism, and we know the demand has grown, but have we done better than previous insofar as diagnosis goes for autism in both adults and children? And a comment to say, you know, the autism spectrum, for them, we've got this enhanced health checks. I think we've got loads of health checks for learning disability and autism as well. I just wondered whether there should be more consideration for pre-diagnosis and post-diagnostic health, more for autistic patients, rather than looking at more health checks, which we probably do a hell of a lot in general practice. Thank you.
Okay, thanks, Dr. Mutu. Other people might have just struggled to hear that a little bit, so I'll just try and rephrase the question. I think the question was, Dr. Mutu, are we doing more activity than we were doing previously in respect to the diagnostics, was the question. So, Matt, could you respond to that?
Yeah, are we doing more activity? Yeah, the answer is yes. Obviously, as Ian identified, that adult service, that diagnostic service that sits with Ardash, is a service that's only just over a year and a half old. At September 20 we kicked in, didn't we? And so it's prior to that, the service users were referred through to Sheffield, and I think it's fair to say there was probably a reluctance for some people to go to a service that wasn't local to them. So consequently, I think the reality is, once we've got a local service, the doors have opened. GPs have taken up the opportunity to refer in where appropriate, and the activity levels have continued to grow from day one, I think. The other elements that I think you were asking about, Dogs, is the alternatives, the other things that are provided for people. So the parents and carers service that provides the post-diagnostic support, provides wraparound support to people on an ongoing basis, and is accessible at whatever point people need it. So that activity is also significantly increased as well. And just to kind of put you in a position, at the end of towards the end of April, that's the most recent kind of validated position we got 168 individuals on the waiting list. The longest wait for those was a wait of 36 weeks for an individual. So from a service that when we started off, we're seeing everybody within 2 to 3 weeks, that kind of picture of continued referral in, and the capacity to address that has continued to challenge, really.
Okay, well, thanks everyone. I'm just going to wrap up that conversation there, if that's okay. So thanks for the update, and thanks for the responses. Obviously, good at big. I think the ambitions are absolutely right in this area, but we accept this is going to be a really challenging target for us, and we've got to keep the energy up and keep the pressure up as we go forward. Okay, we'll keep a close eye on this as a board then, and we'll take regular feedback from this work stream. So thank you everybody for the updates today. I'm just going to finish off our agenda because we're just coming towards the end of our time now. So we've got the action log and draft minutes from our April meeting. Lydia, is there anything you want to flag up to raise?
No, action log, all actions are on track. Just to say that the review of IT services will come to the June Place board.
Thank you, Lydia. And also just on the minutes, is there anything anyone wants to raise in terms of accuracy on the minutes? Okay, thank you. We'll take those as an accurate record then. Thank you very much. Thanks, Wendy. So communication to partners as a result of our discussions. Is there anything, Gordon, is there anything we want to flag up?
I've not picked anything up, Chris. I think Stefan and I have had a discussion about the event previously about how we communicate that out. So we'll pick that up separately. Okay, thanks, Gordon. And in terms of risks and items for escalation, I think that we've picked that in terms of setting our agenda, haven't we? I mean, children's and young people, mental health and LD, learning disability, autism and urgent community care, they are our key priority risk areas. So the agenda's flagged them up as we've gone along. So unless anyone has any objections, I think we've probably covered that agenda item throughout our agenda. Okay, so next time we've got the, we talked about the digital update, Lydia, didn't we? And we've got the Rotherham Integrated Care Development Plan updates scheduled in for June. I think we probably will need an update on the development of the South Yorkshire Integrated Care Board, because we, on April the 28th, Royal Assent was achieved for the bill. So we now know the Integrated Care Board will form for South Yorkshire on the 1st of July this year. So it's probably worth a discussion next year about what that means for us as a place partnership. I'm sure we can update Sharon, can't we, on the potential future direction for governance arrangements and how it will work for us as a board. So if we can put that on the forward agenda, we'll pick that up for a discussion next time. Is there anything else anyone wishes to flag up for our meeting next time? Okay, if anyone does have any thoughts or feedback for us, myself and Sharon are always open to feedback. And if you've got anything you'd like to raise on any of our agendas, then please do send them to us. Otherwise, just on meeting dates, Lydia, could we just update on the plans for future meeting dates, just so people know we might be changing our forward schedule?
Yes, of course. So from June, we're going to be moving our dates to potentially either the 2nd or 3rd week of the month rather than the 1st, so it doesn't clash with the ICB board meetings. We're going to just check a few key meetings before we actually do this, but hopefully get the changes out this week. Thank you.
Thank you. So just before we finish, just one last thing. I just wanted just to take a moment just to thank Matt Pollard for his participation in the meeting. Matt's been a real founding member of this place board, and Matt, I believe it's your last meeting today. So I just wanted just to put on record the thanks from everyone.
Thank you, Chris.
Thanks from everyone for your participation. You've been a much valued member of the team, and we all wish you a happy, healthy, long retirement.
Thank you very much. Took me by surprise there, Chris. Thank you. Thanks for the comments. Thanks for the support from all colleagues sitting around the table. Been a pleasure working with all of you, and good luck with things in the future. Great place to work is Rotherham. Great place to live and continue to grow because of the work that's been done. So thank you. Been a pleasure.
Okay, well, thank you, everybody. Thanks, Matt, particularly. But thanks for everyone who's fed in today and all the hard work that's going off. We do appreciate it. And we'll see you all when we next meet. Thank you very much.